This is a bit of an unusual one today because I am in the interviewee's chair rather than the interviewer's chair. I'm joined by Trevor Punt, the event director at Abu Dhabi Global Health Week, and he's going to be asking the questions. Trevor, away you go. What do you want to know?
Is the show doing what we wanted to do? Is it hitting the target market? And really what I wanted to know from you, because you do a lot of shows and you speak to a lot of people, are we on the right track in terms of the content? Are we on the right track of the format? So what's your view on that?
Welcome to another edition of the HealthBeats podcast. I'm your host, Steve Gardner. We are here at Abu Dhabi Global Health Week for another podcast supported by this great event and looking forward to, looking at what's happened this year and what's going to be happening again next year. This is a bit of an unusual one today because I am in the interviewee's chair rather than the interviewer's chair. I'm joined by Trevor Punt, the event director at Abu Dhabi Global Health Week, and he's going to be asking the questions. Trevor, away you go. What do you want to know?
Well, Steve, as you know, you've been with us for 2 years now. You're part of the ADGHW family. I wanted to get your, from an organizer, we're interested in the feedback. We want to know where we're going. Is it on the right track? Trade shows tend to address the market in which they take part. So really what I wanted to do is to get your take on, is the show doing what we wanted to do? Is it hitting the target market? And really what I wanted to know from you, because you do a lot of shows and you speak to a lot of people, are we on the right track in terms of the content? Are we on the right track of the format? So what's your view on that?
You're right, Trevor. I do an awful lot of these all around the world, across the Middle East and globally, in the US, in the Asian market, the African market, etc. And I think one of the wonderful things about Abu Dhabi Global Healthcare Week in particular is that it's got a slightly different tone and tenor. You go to a lot of these shows where you've got a lot of people selling consumables, selling kit, selling equipment, but not really addressing the needs of the healthcare system and the development of the healthcare system. What I love about Abu Dhabi Global Healthcare Week is you've got the support of particularly the Department of Health. They're obviously keen to promote Abu Dhabi as a major player, both in the region and globally. And one of the things that I love about being here at this event is understanding their level of ambition, what they're looking to achieve, the objectives that they've set themselves in terms of, increasing healthy lifespan, looking at the kind of preventative healthcare agenda, looking at the way a system is put together. So for me, when it comes to kind of recommending people to come here to Abu Dhabi, a lot of it is about, being able to get that really deep understanding of what is happening in the system from a payer perspective, from a provider perspective, and from a government perspective, and understanding that ambition and scale. And also, I think the desire that there is across the Middle East. I think no other region do I work in where there is more of a will and a desire for collaboration, for partnership, for discussion. I think there's something about the Arab psyche, about the ability to listen, to want to learn, and to want to understand. And that, I think, is what's wonderful about what you've created here in Abu Dhabi.
Yeah, and I think that's the ethos of the DOAs. It's all about collaboration and cooperation. And over the last couple of years, we've moved from looking at more horizon scanning, which is the future of healthcare, obviously, to more of the longevity and that, where we now actually become healthy and longer living over time. Is that where the narrative and the conversation is going? Is that where what we should be talking? Are we leading the narrative, or are we behind the curve? Where are we?
Interesting question, because I think one of the things that people don't get when they come into this market is an understanding of just how developed the market here is and how developed the thinking and the ambition is. So the example I'd give you is, you get a lot of international companies, even health systems providers, coming into the region thinking that they are here to sell something, that they're here to pitch. That's not the approach that I would advise anybody to take. This market is about partnership. And actually, the thing that you will realize very quickly when you come into the Middle East is that actually they're probably ahead of us in terms of European markets, US markets, because you've got ambitious healthcare systems that, look, let's be honest, they have the money, the will, the ambition, and in many ways, a kind of a green field that they can build on. So as a result, they've spent a lot of time thinking about actually the exam question of what does a 21st, even 22nd century health system that is data-driven, that is digitally enabled, what does that look like? How should it work? And how does it enable the patient? So actually, the debate and the discussion here a lot of the time is about giving an understanding of what they've got, but also then being open to understanding and listening to what the best bits of the health systems are and how they can incorporate those and how they can share that knowledge. I think that's the really fascinating piece. But yeah, ultimately, the answer to your question is Middle East is ahead of the curve, not behind it.
Yeah, and we've had this conversation of when we've been in Saudi and other places around here, and you've actually expressed the opinion that the UAE and the Saudi are the two biggest investment markets probably in the world at the moment. As you say, they've got the money and everything else. Where should they be looking to invest in going forward? Because this is where we're going with the show. What are we, as an organizer, what should we be looking to bring into the show, content-wise? But where do you think is the next big growth market or growth product or sector that we should be aiming for?
Well, I think the obvious answer to that is AI. If you look at the amount of conversation about use of AI in healthcare, it's insane. I mean, you've had a situation this week where G42 have announced a $1.3 trillion investment in US AI, along with Cleveland Clinic. So there's a huge amount of investment going on in AI. I think there is a thing here about understanding what the steps are towards truly encompassing AI, understanding what AI actually is and how it can work and how we can contextualize it. I think that's really important. There's the piece there about data and understanding of data. It's been said on interviews and on stages that I've done all over the world that we have a global responsibility, an ethical responsibility to share healthcare data across the world. And I think nowhere is there a better example of that than here in Abu Dhabi. You have the Malafi program that has ensured that the sharing of healthcare data in this emirate is mandated. 100% of the indigenous population here in Abu Dhabi have their healthcare records shared across the piece. They also have their genome sequenced. Again, 100% of the population have had their genome sequenced as part of the Emirati genome program. And there is then the thinking about how you take this data and you operationalize and you use it. So I think the big growth area over the next few years is that move from healthcare, or sick care, should I say, to true healthcare, to preventative care. Public health messaging, understanding how we can affect lifestyle change, how we can stop people from getting involved in the healthcare system in the first place. There's a really interesting area, I think, in terms of development and thinking that we haven't quite cracked the nut of yet, which is the point about value-based care. How do we go from an activity-based payer model, where it's essentially the payer pays the provider to do it, and every time they do a thing they get paid, to actually creating true outcome-based models where it's actually about actually you get more money if the patient recovers more quickly. Really interesting question. How do you incentivize and contract with a payer to stop people from entering the healthcare system in the first place? Can we create contracting models based on data, based on AI, that will actually allow us to say, okay, the fewer appointments we have, the more the payer model is. How do we keep that population healthy? Those that I think are the big questions in healthcare and the big areas of investment over the coming years.
And you touching there on data and AI and everything else. And yes, it is, I don't think over the last year since the two shows have happened, I don't think I've had a conversation where AI has all popped up. Obviously, there is issue, here data is readily available and the government will actually want to have data sharing, and that's how they've done the genomic program and everything else. How does that relate to the international markets? I mean, you and I from the UK, that years ago they tried to do an ID card with all the information on. It didn't work. So how does this model then translate to the rest? How does the DOH take the lead and actually convince everybody else that they should actually, you go into a doctor, dentist, whatever it is, and your detail is readily available? How do they convince other countries to actually follow the DOH lead?
It's a difficult question, and it's a difficult thing to achieve simply because what they've built here, they've built on a green field. They've also, from a political will point of view, you look at the NHS in the UK, you look at other health systems around the world, they are subject to the whims of government. Governmental change happens every 4 to 5 years. Therefore, it would be impossible to implement the kind of 10, 15, 20-year plan that you see with the health holding company in Saudi. There's also an issue around legacy. So one of the problems that we have in the NHS in particular is the fact that you've got a 48-year-old, 50-year-old, free at the point of delivery healthcare system, where you're running at different speeds on different systems. It's an incredibly difficult thing to do. I think what the region and what Abu Dhabi and the DOH in particular can demonstrate is the fact that this can work and how this can work. And that's the kind of trail that they're blazing. I think there are some issues around data sharing still, particularly internationalized data sharing. There is an issue in the UAE, for example, around the fact that, that the whole Sahatna Malafi system is built on a sovereign cloud. There are legal implications around federal data laws that mean that they can't offshore data. There's a diplomatic problem that needs to be solved here, not just in the UAE, but globally around how we share data. You've then got a second question of how you make that data interoperable. Yes, we have international standards, we have HL7, we have FHIR, but at the end of the day, they are not universally adopted. And also, when you get to the US, for example, you've got a disparate model where you've got 50 states. Each state is regulated independently. They have their own nuance on data law. There's no central health system. The US is incredible. It's the only country that I've visited that doesn't have a Ministry of Health or a Minister of Health. It's 50 health systems. It's not one. And that's interesting, actually, from the point of view of as an international player wanting to globalize, wanting to cross borders. Where do you go first? The advice I always give to our partners and clients is, particularly if you're coming from a European, socially led governmental health system free at the point of delivery like the NHS, going straight to the US is an absolute nightmare. The Middle East actually is the perfect stopping point in the middle because you're going from that one end of the spectrum, the free at the point of delivery. I think I once described the NHS in the UK as the magic money trick because no clinician in the UK ever looked at a patient and said, I can't afford to treat you. And frankly, most clinicians in the UK don't understand the cost of treatment. To the other end of the spectrum in the US, where it's literally, the stories of people getting hit by a taxi in New York City, are lying there in the street with a bone sticking out of their leg saying, don't call me an ambulance, I can't afford one. The Middle East is that kind of middle ground, is that perfect middle ground of understanding, as DOH do brilliantly here, the social responsibility of government to ensure universal health coverage, but at the same time, a vibrant private sector, a vibrant insurance market with some really high-end facilities. I mean, the Cleveland Clinic here in Abu Dhabi is possibly the only hospital I've ever seen in the world that is a bona fide tourist attraction in its own right. I went to a function there last night. Only hospital I've ever been to that has a ballroom. It's an incredible thing. So I think there are so many examples that can be followed from this region. And it's also an interesting translational tool between the two ends of that healthcare payer spectrum.
So you do our live stage interviews and very, very well, and it's sort of interesting, and that will continue to next year. You also hold our podcast over, and there's a lot more to come. Where's the conversation going with the live stage and with the podcast? Where do you see, and who would give us the wish list of who you would like to talk to?
I mean, I think from that point of view, we've talked about a kind of developmental structure over the next 12 months that I think is going to be a huge benefit, both to healthcare world as your partner, as your long-term partner, and to ADGHW, which is really trying to use the time between now and next year to really get under the skin of where the developments are, the ideas are, the innovations are, and frankly, the drawbacks, the problems, the challenges in this health system. So from that point of view, we're looking to come back here in September, work with you guys around creating an Abu Dhabi healthcare forum, a series of roundtable events bringing together the independent providers, the DOH and government, the regulator, and the big provider groups here in Abu Dhabi with international delegates from the UK, the US, Europe, etc., for a series of really in-depth discussions to get under the skin of understanding how Abu Dhabi wants to interact with the rest of the world, where the issues are, where the opportunities for collaboration lie, and then using those roundtables to create really high-level content that can feed into next year's event. If we can get under the skin of getting out into the world, looking at health systems from all over the world and understanding what they have to offer, where the innovations are, where the real pockets of smart thinking are, and bring them here to the event next year, put them on the live stage, put them on the podcast, we can develop what is already a fantastic event into a real globally leading event that is absolutely at the cutting edge of what innovation in healthcare looks like. I think it's about putting in those hard yards and having those conversations that can then be presented to the world at this event next year.
And a final question, that is, you go to a lot of other shows, you speak to other people with the magazine, and your the general chit-chat to getting under the skin of the industry. When you're talking to people, what would you say to them? Why would they want to come to ADGHW next year? What's the USPs for them?
I mean,
give them the sales pitch.
Well, I mean, the first part of that, I would say, and this may not be the answer that you want to hear, but it's not stupidly busy and stupidly big. And I think that there are some events in the US and in other parts of the region where they've just grown to such a degree that actually finding the people you want to talk to and having the relevant conversations is really, really difficult. Abu Dhabi is a unique market in the respect that it's pretty much dominated by Pure Health and M42 as two mega providers. You've then got the DOH that sits above them with the various initiatives around Sahatna, the publicly facing app that's available to every citizen, Malafi and the healthcare data, the Emirate genome program, all of the incredible ambition that sits around here. And the great thing is you can go over there and you can go and find the people just milling around having conversations who are at the center of that development. And that is an incredible benefit. The fact that you've got an event which is stitched in to the DNA of this health ecosystem provides the most unique opportunity to actually go out and have conversations with the people that matter. That really for healthcare world and for our partners that we bring into market from all across these different global systems, this is one of the most valuable events that we do. And the feedback that we have from our customers, from our friends and partners when we come here is that this is the most valuable event because the focus is on the development of not just this health system, but global health systems. And if I was going to give people one reason to come here, it's that. It's the ability to find and have the conversations that you really, really need to have. And I think that will continue to develop because I think you're developing a reputation here as an event that people that will have the discussions and the conversations that matter. That's really, I think, the key reason to being here.
And I totally agree. So listen, looking forward to the next 12 months. We're aiming for next year. So looking forward to continue the podcast. We'll obviously work with you on the agenda for next year on the live stage. So thanks very much. See you next year.
Thanks, Trevor. No, really appreciate it. And we have got so much more content that we've created on this podcast. We've got some incredible interviews. We've interviewed some unbelievable people this week at Abu Dhabi Global Healthcare Week, and we've got a whole load more. And the only way you can get access to that content is by subscribing. So get yourself onto Apple Podcasts, get yourself onto Spotify, get yourself onto whatever other podcast platform you've got, because the next best thing to being here is accessing this content and listening to this debate and conversation. I look forward to seeing you on the next one. Thanks very much, Trevor. Thanks very much, Abu Dhabi Global Health Week. It's been an incredible week, and thanks to you for listening.